Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing the medication known as Nitrofurantoin. Its brand name is Macrobid. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So nitrofurantoin is reduced by bacterial flavoproteins to reactive intermediates. These intermediates inactivate or alter bacterial ribosomal proteins and other macromolecules. They cause inhibition of vital biochemical processes and synthesis of DNA, RNA, the cell wall, as well as proteins. In terms of indications for use, nitrofurantoin is indicated to be used in the treatment of a UTI or a urinary tract infection, and it can also be used prophylactically to prevent urinary tract infections. Now, before somebody was to use nitrofurantoin, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication will be contraindicated in patients who have a known hypersensitivity to nitrofurantoin or any other component of the product. It will be contraindicated in patients who have anuria or the inability of the kidneys to produce urine, as well as in patients who have significant renal impairment. This is mainly due to the fact that patients with significant renal impairment will be at an increased risk of toxicity using this medication due to impaired excretion of the medication. This medication will be contraindicated in pregnant patients during labor or delivery. And finally, it would also be contraindicated in patients less than 1 month of age. Now, in terms of precautions, patients should be made aware that acute and chronic pulmonary reactions have been reported in patients treated with nitrofurantoin. Hepatic reactions, including hepatitis, hepatic necrosis, cholestatic jaundice, and chronic active hepatitis, have rarely been reported. However, there have been some fatalities reported as well. If hepatitis does occur while a patient is using this medication, the drug should be discontinued immediately. Peripheral neuropathy may occur with nitrofurantoin therapy, and this can become irreversible and severe. Patients would be at an increased risk of developing this if they had renal impairment, anemia, diabetes, an electrolyte imbalance, vitamin B deficiency, or other debilitating diseases. Once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use nitrofurantoin, they can expect to receive their dose orally. If they were using this medication to treat a urinary tract infection, they would typically use 50 to 100 milligrams 4 times daily for 1 week. If they were using this medication prophylactically to prevent urinary tract infections, they may use 50 to 100 milligrams each night. Now, in terms of side effects with this medication, some patients may experience nausea, others may experience vomiting. A headache is a possibility with the treatment of nitrofurantoin, and some patients may experience flatulence or the passing of gas. Now, some more rare but serious side effects would be the development of a lung disease, which may include fever, cough, chills, chest pain, and shortness of breath. They may experience liver problems, which could result in their skin turning a yellow tinge. They may become itchy or have dark-colored urine. And some patients may also experience numbness or tingling. That's all we're going to talk about today with nitrofurantoin or Macrobid. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.